Hi everyone. In this lecture, I'm going to be talking about how we can make the best use of a PSA result in terms of interpretation and clinical use for affected patients. PSA is one of the commonest tests done by men, especially people above the age of 40, usually to check whether they have prostate cancer or prostate enlargement. It is secreted by the prostate gland and circulates in blood either as free or bound to proteins. Levels of PSA may be elevated in pathological conditions like prostate cancer and benign prostatic enlargement, and in other non-pathological conditions like patients who just had a rectal examination and after a coitus. The most commonly type of PSA measured is the total PSA, which usually comprises of the free PSA and the bound PSA, with reference interval varying between 0 and 10 microgram per liter. So values above 10 microgram per liter are highly suggestive of a pathological conditions. However, values below 10 microgram per liter does not necessarily mean that patient does not have a prostate cancer. As a result of that, any patient that has a PSA value above 4 microgram per liter will usually require a further examination in order to confirm that they do not have a pathological prostate condition. This can be a major limitation of the use of total PSA as a measure of prostatic health. As a result of that, there are other considerations that can be put to use in order to determine or to improve the sensitivity of PSA in determining whether a patient has a pathological condition or not. We have evidence to show that some patients with prostate cancer have PSA value within the normal reference interval. And there were some prostate cancers that were discovered at autopsy in men who had no symptoms before their death. As a result of this finding, it becomes very clear that measuring of total PSA may not be enough to indicate or to identify all patients that has prostate cancer. And this has given birth to the age-adjusted references, in which different reference intervals were allocated to different age group of men. This gave consideration to the fact that as people get older, their total PSA value gets higher. So higher reference values were allocated for people who are older compared to people who are younger. So the values for each age group is indicated 0 to 2.5 for people who are between 40 and 49, 0 to 3.5 for people who are between 50 and 59, 0 to 4.5 for people who are between 60 and 69, 0 to 6.5 for people who are between the age of 70 and 79. In essence, the use of age-adjusted references for PSA can help to identify patients who have cancer of the prostate much earlier than if the general reference interval has been used for them. PSA density can be calculated by dividing the value of the total PSA by the volume of the prostate gland, which can be determined by ultrasound scan. This is to account for the apparent increase in the amount of PSA produced by men with larger prostate gland, especially people with benign prostatic enlargement. So, in patients who have an apparently normal level of total PSA and a negative digital rectal examination, PSA density may be the only way to indicate or to find out that they have a prostate cancer, especially if the value is above 0.15 nanogram per ml per cubic centimeter. This is to further support the fact that not every patient who has a normal total PSA of 4 to 10 microgram per liter are not patients with prostate cancer. A PSA density of more than 0.15 would ordinarily override a normal total PSA, thus indicating a higher clinical utility over the ordinary total PSA that has always been done. I mentioned earlier that total PSA is equal to free PSA plus bound PSA, and it is the most commonly requested type of PSA from the laboratories. However, the calculation of percentage free PSA can help us better to identify patients who has prostate cancer. This is done by dividing free PSA over total PSA times 100%. Patients with prostate cancer tend to have less free PSA because more of their PSA are bound to proteins. So, in men with total PSA of between 4 and 10 microgram per liter and a normal digital rectal examination, percentage free PSA can be calculated, and if the value of PSA is more than 25%, it is most likely that patient has a benign condition. However, if the value of percentage free PSA over the total PSA is less than 25%, it is highly suggestive of a malignant condition. Lastly, one can calculate the PSA velocity, which is the rate of PSA change over time. In order to do this, one has to measure at least 3 PSA results over an 18-month period. And if there is an increase of more than 0.75 microgram per liter per year, it is highly suggestive that the patient has a prostate cancer. Even if the patient has a relatively normal total PSA, a PSA value of more than 0.75 microgram per liter per year is more reliable indicator that the patient has a prostate cancer than ordinary total PSA.